Hello, everyone, and welcome back to season two of A Doctor's Insight. So, as you all know, we've had a little break, but we're back with more specialties for you to learn about and get a bit more insight into. And today we are beginning with Mr. Marsden. Now, he completed his medical training at Cardiff University in 2007, and then he went on to do some foundation training in Brighton and Sussex Medical School, where he was also an anatomy demonstrator. In 2013, he was successful at a national selection number and was awarded a 6-year national training number in plastic and reconstructive surgery at the Welsh Centre for Burns and Plastic Surgery, Marsden Hospital, Swansea. During his training, he was awarded a National Institute for Social Care and Health Research funded clinical research position, which led to him being awarded an MD from Swansea University. He was awarded an FRCS in 2018 and has gone on to work as a microsurgical reconstructive fellow in some of the most renowned centres in Melbourne, Australia, as well as being the senior microsurgery fellow specialising in lower limb reconstruction in Bristol. So Nick is a consultant plastic and reconstructive surgeon at the Welsh Centre for Burns and Plastic Surgery, Swansea, and he also works at the Major Trauma Centre in Cardiff. So thank you so much for speaking to me today.
It's a pleasure. Thank you very much for having me and for that very kind introduction. It's actually, even though that's the sort of thing you have on all of your conference speaks, it always sounds very strange when someone else reads it. It's a bit embarrassing, but thank you very much.
Not embarrassing at all, but it is very impressive. And I wanted to talk to you today because plastic surgery is not something that medical students get much insight into. So can you just start by telling us a bit about what the specialty is like?
Yeah, you're exactly right. I had absolutely no exposure to plastic surgery as a student. As I said, I was in Cardiff University, even though we have the Welsh Centre for Plastic Surgery 40 miles away in Swansea. I had no exposure to it as a medical student. Thankfully now we do get students in our unit from both Swansea and Cardiff Uni, but when I was in the early 2000s we had no interaction with plastic surgery, so it's something that I'm not sure is well covered in medical schools. So if you probably asked the general public what does a plastic surgeon do, they'd probably talk about bums, boobs, Botox, facelifts, that sort of thing, which it is part of some plastic surgeons' careers, but plastic surgery. So plastic surgery comes from an old Greek word called plastique, which means to mold or to form. So plastic surgeons really describe our specialty as restoring form and function. So restoring how things look and how things work. So we're reconstructive surgeons. It's I think a fantastic specialty, which is why I chose to do it. But some plastic surgeons would describe plastic surgery as we're the sort of the last of the true generalists. I don't completely agree with that. When I was a houseman, he was quite a well-known colorectal surgeon at the time, was telling me about how when he was a junior consultant, he was working on one of the Shetland Isles, and he would be doing a bowel resection followed by a hip fracture fixation, and then a C-section come in, and he would do all of it. And that was a true general surgeon, as we would call them. So there's no such thing as that anymore. But why it's sort of generalist is because as plastic surgeons, we operate from cradle to the grave. So my pediatric plastic surgery colleagues will operate on premature babies, to 100-year-old patients with malignancies needing reconstruction. So there's no age boundaries within our specialty. There's no anatomical boundaries. We operate from head to toe. We're not just skin surgeons. A lot of people think we're just skin surgeons. We stitch wounds nicely. We operate head to toe, and we operate with lots of other subspecialties. So I work very closely with orthopedic surgeons because I'm a trauma reconstructive surgeon, but we work with breast surgeons, maxillofacial, ENT, neurosurgeons, general surgeons. So there's a lot of cross sort of specialty integration. We also it's often seen as the problem solvers if other specialties have complex wounds that they can't manage or defects following an oncological resection, then often we are the people that are called to try and help out with those difficult sort of patients. So yeah, it's very diverse. It's a hugely diverse specialty. There's lots of different subspecialties within plastic surgery. So there's about 11 probably recognised. Skin cancer or skin surgeons and hand surgeons and upper limb are probably the most common. But there's breast surgery, burns, head and neck, lower limb reconstruction, which is what I do, cleft palate reconstruction, craniofacial, genitourinary and abdominal perineal. So there's a huge variety within the specialty of plastic surgery. And I just think it's a fascinating specialty. It's no 2 days are the same.
It's
I imagine I'm not an orthopedic surgeon.
so
I
much
work closely
to do.
with them, but a lot of some good friends of mine who will do a lot of the same operations. So that may be a hip replacement or knee replacement, where there's new robotic assisted knee replacements now, but a lot of it is sort of protocol driven or the steps, stepwise approach to an operation. Whereas in my specialty, we could be presented with a devastating injury with a huge complicated wound or something that needs reconstructing, and it's not something you can read in a textbook. It's just applying good anatomical knowledge with basic sort of principles, surgical principles, reconstructive techniques, and you have to be creative, think on your feet. And actually, that's one of the things I love about my specialty is you never know what you're going to get next, and you just have to, often problem solve and work out the best way to restore form and function.
And as you said, there's so many subspecialties within plastic surgery. So why did you choose lower limb reconstruction specifically?
So I like microsurgery. So I'm a microsurgeon, which again is, as it says on the tin, it's performing surgery but on a very small scale. So it's sort of using body parts to recreate or reconstruct other body parts, where we're rejoining blood vessels and nerves back together in different parts of the body to sort of reconstruct defects. It's very challenging. As I said, I remember one of my consultant colleagues when I was a junior plastic surgeon saying to me, if you master microsurgery, then nothing will ever sort of not stress you out, but you'll have a way of reconstructing something. You'll have a get out of jail card, because with the ability to reconstruct something microsurgically, there's not that many defects that you can't find a way around. Obviously, there are things that aren't reconstructible. So having that capability to know that actually I've got the skill set to, deal with most injuries or defects that are presented, whether they're traumatic or congenital or oncological, that was quite a nice, that's what drew me towards microsurgery. Lower limb in particular, I've always liked trauma, and it was also, you have to be honest. I wanted to work where I work, and you have to plan in advance, and you've got to look at where you think there are going to be jobs. And with the development of the major trauma network in Wales, South Wales, which is the last major trauma network to be developed in the UK, we're a bit late to the party. There was going to be a need for sort of major trauma limb reconstructive surgeons. So the fact that I enjoyed microsurgery, it kind of, it made sense for me to go down that route.
Yeah. And you talked about reconstructing like nerves and blood vessels and things like that. But in any one day, do you see or do you perform surgeries on more common presentations than others?
So so most plastic surgeons, well, particularly my unit, will have, a main subspecialty interest. So mine is lower limb or limb reconstruction microsurgery. But then a lot of my colleagues who may be the burn surgeons also have another specialty interest. So they are burn surgeons, maybe 60% of the week, but then they'll have a practice in skin cancer or laser or facial reanimation. Mine I do mostly major trauma limb reconstruction, but I also do some general plastic surgery. So that's skin cancer, any basic sort of some congenital things like patients with prominent ears, so children with prominent ears, patients that have had massive weight loss that may come through the NHS that meet the criteria to have sort of body contouring surgery following massive weight loss. So a bit of generalised, but mainly skin is my additional. So that's patients presenting with so the common things are melanoma, basal cell carcinoma, that sort of thing. But as I said, because most of my work is in Swansea, which is the Centre for Plastic Surgery in Wales, I also work in the Major Trauma Centre, and that could be anything. It's not just traumatized limbs. Anything that comes in that requires the expertise of the plastic surgeon through the Major Trauma Centre doors is something that we will get involved with. I also have a sort of interest in, again, it's limb related, but so bone infection and chronic limb injuries. So again, it work very closely with my orthopedic colleagues managing osteomyelitis, which is sort of bone infection, because obviously that sometimes has a soft tissue element to it. So you can't fix bones or treat bone infection unless you've got a good, healthy soft tissue surrounding. So we work very closely doing that as well.
And it sounds like you do a lot, and there's so many things that you can specialize in. So what is your favorite part about the specialty?
I think, as I said earlier, it's the sort of the challenge of not knowing, what the next patient may come in with, and having to be creative and think of new, innovative ways of reconstructing, not just, how things look, but how they work. And the fact that I get to work with friends across multiple different specialties. So it keeps you on your toes. You're always learning, because, as I said, it's not just plastic surgery that I'm learning from. I'm learning from my orthopedic colleagues. I'm learning from my sort of general surgeons. When you're working with other specialties, you have to keep on your toes and keep up to date.
And on the flip side, what is your least favorite part, if anything, about the specialty?
So as a microsurgeon, we call them flaps. So a flap is sort of moving a piece of tissue with its own blood supply to another part of the body. So once you've done that, sometimes it goes, well, touch wood, most of the time, 95% of the time, it goes fine the first time. But if it doesn't, it can turn a long operation. So most of our operations that we do for sort of salvaging traumatically injured limbs can last anywhere from sort of 5 to 6 hours in operation. And that's working simultaneously with my orthopedic colleagues. But if it doesn't go well first time, or there's problems, we've had cases that have gone on 12 hours. So knowing that you could be in for a long day in the office, and then it's not just then actually, that patient, I may not be on call, I'm not the on-call surgeon, but that's my patient. And if something goes wrong in my branch of surgery, then they have to go back to the sort of emergency to salvage that reconstruction. So you're kind of on call a lot of the time for your cases. So that's probably the only downside I see. But I wouldn't do it if I didn't love it.
Yeah, that's true. But it sounds like going from a 5-hour surgery to a 12-hour surgery is quite a
Yeah,
stretch.
it doesn't happen.
It?
It doesn't happen often, and we have breaks. We work as a team, so I work in a great team. So we're often, you're relieving each other for coffee breaks and that sort of thing. So you're not there at the table for 12 hours straight. And it's always great working with colleagues that you can trust, that at any point, if you need to go away and have a break, have a coffee, have some lunch, that our patient is in safe hands, and you trust them implicitly with the surgery.
And you spoke a lot about working as a multidisciplinary team with different specialties. And it sounds from what you're saying that sometimes you work more closely than other specialties would with different disciplines. Would you say that's the case?
I would say so, yeah. As in general, plastic surgeons work quite closely with other specialties, probably more so than any other specialty, I would say, because we're reconstructive surgeons. I work very closely with orthopedic surgeons and my plastic surgery colleagues, but some of my other colleagues who do breast reconstruction, for example, will be doing all of their operations with a general breast surgeon who will do the mastectomy, and then my colleagues will be doing the reconstruction. Similarly, one of my colleagues who does and works very close, probably works twice a week with general surgeons doing the reconstruction following sort of rectal cancer. So I think our specialty probably has the most cross sort of pollination with other specialties. Purely because we have that sort of reconstructive element to our job title, and that's, you know, that can be of use to other specialties.
And you spoke briefly before that medical students, for some reason, don't get much exposure to plastic surgery. So would you be able to hazard a guess as to why that's the case?
Well, you could say plastic surgery is a fairly niche specialty. There's something like, you know, over 1,200 hospitals in the UK, yet there's only just over 70 plastic surgery units in the UK and Ireland. So like 60 something in England, in the UK, and about 8 in Ireland. So most hospitals will, for example, have an orthopedic surgeon or a general surgeon, but, you know, a tiny proportion of hospitals across the UK have plastic surgeons. So it's not it's not some of the common presentations to hospitals. So it's probably not as huge part of the curriculum in any medical school, even when there's a plastic surgery unit on site as part of the university teaching hospital, which is a shame because, you know, as I've highlighted, we are involved in so many other specialties. I think it's a shame that there isn't more exposure to it. I think that is changing. As I said, we have students constantly with us on both sites in Swansea and in Cardiff now, but it certainly wasn't when I was a medical student. Yeah, it's, you know, there's only just over 700 plastic surgeons in the UK, which the number is sort of increasing slightly. We've only got sort of 650 trainees across the UK. So it's compared to a lot of other specialties, it's pretty small. It's probably one of the smallest specialties there is.
So they really
we try and spread the word of what we do and get people interested.
So there really isn't much room for that many medical students to, you know, be on the wards in these plastic surgery units.
Because as you said, a few. Yeah, often we have, you know, we have sometimes 2 or 3 in a single case, and then the theatre managers get all stressed and come in. There's too many people in here. Do they all need to be in here? I'm like, yes, they need to see this. They need to learn. So no, we have plenty. You know, we're always happy to have medical students. You know, often I have students contacting me. You know, it's not part of their curriculum, but they say, oh, I've got so many weeks during the summer holidays, I'd love to come and, you know, see what you guys do. I'm interested in it. Don't really know much about it, and that's great. And we'll always, you know, go out of our way to try and, you know, help students or junior doctors. Even we have junior doctors that will organise tasting. We've organised a few taster weeks with junior doctors from elsewhere that again have sort of come across us when maybe we've been in doing an operation with the specialty that they're working in, and they think, oh, this is, you know, I'd like to get a bit more of a, you know, I feel for what this is like. So we've done some tasters, and again, we'll always try and help where we can to get people exposed to the specialty, because I say until I had my first exposure, I'd never even contemplated it as a specialty, and I was just fortunate to sort of stumble across it in a roundabout way to get into plastic surgery.
So any Cardiff or Swansea medical students who are interested in plastic surgery can just send an email about their interest and hopefully get a shadow or so.
Yeah, and it may not be, you know, I'm happy to get, you know, be contacted, but if as I do, you know, I'm quite niche in what I do. What we try and do is get them into the department and they get sort of free roam, so that they'll be able to get a grasp of all those sort of different subspecialty areas within sort of a week.
Perfect. So now we're moving on to
taster weeks, electives. That's another thing. I didn't do an elective in plastic surgery because, as I said, I had no real idea about it at that time. But anyone that has an inkling that it may be an area doing electives, there's some fantastic electives all over the globe. That would be great for medical students to get a real grasp of it. And that obviously looks good further down your line if you do follow that career path, that you've shown a sort of commitment early. So that's always a good little technique in whatever specialty, not just plastic surgery. If you have an idea what you want to do early as a medical student, having an elective in that is always beneficial.
That is true. Yeah, I didn't think of electives, but that's a good opportunity as well. Okay, so now we're moving into a bit away from the specialty and more so about your path into plastic surgery. So you talked about liking trauma and a bit of orthopedics. So why did you choose plastic surgery in the end?
Good question. So I knew pretty early on, actually probably even before I started medical school, that if I was going to be a doctor, I wanted to be a surgeon. Wanted to be hands-on, like doing things, being creative. So I always wanted to do surgery. Throughout my medical training, I always thought I was probably going to be an orthopedic surgeon. I had quite a few placements in it, and I enjoyed the trauma aspect. But once I started doing knee replacement after knee replacement, it didn't thrill me. So I kind of went off that towards the end of medical school. My first house job was in pediatric surgery, and I loved it. And after those 4 months, I think pediatric surgery is the area for me. But it just so happened that my elder sister, who's a nurse, married a plastic surgical trainee, and they were living up in Scotland. And I thought, well, he talked very highly of the profession, so I went and arranged a taster week. So a week as an F1, where I went to Glasgow, the Cannesburn unit, which was a famous plastic surgery unit, and just spent a week with my brother-in-law at the unit. And within the first day, I remember it was great. We were in scrubs, and there was maybe 4 operating theatres going, all plus different sort of areas, and he'd be walking me into one, we'd stay there for an hour, the next one, just have a look round. And I remember there was a burns, a patient with major burns in one theatre, and then the next theatre there was a breast reconstruction, and the next theatre there was a teenager who had head and neck reconstruction going on. And I was just, that just emphasised how diverse, and there's so many different things I saw in one day. And after that first day, I was like, this is it. This is what I need to do. And before that, I'd had no inclination that was an area that I'd be interested in or would love. So that one day, so as much as I hate to say it, I actually have to thank my brother-in-law for sort of putting me onto this path. So I try not to tell him that. But yeah, it's down to him really. That first day, I kind of knew that this is where I needed to go, and that at that point, I didn't have the strongest CV. I wasn't a high flyer through medical school, but at that point, I kind of looked into what I needed to do and set myself some goals. That's something I would highly recommend to any medical student or sort of junior doctor. Once you know what you want to do, you're going to have to unfortunately, you need to find out what the criteria is for the next stage up. So it's whether it's getting a themed SHO job in that specialty, and then the step beyond that is getting a registrar. And you can get hold of that information, essentially what the application forms are, and it's a tick box exercise in a lot of ways, and you just need to start ticking those off. And that's what I did. So working towards getting presentations at conferences, trying to attend the plastic surgery conferences, to meet people, get a few publications under your belt. So it's meeting the right people, and everyone does this, and as a consultant now, I get it, and I used to do it. When you get a new group of junior doctors into your department, they all come up to you and say, oh, so-and-so, I'm really keen to do plastic surgery. I really want to get some publications, presentations. And you think, great, and you'll give them an idea or give them something. This is someone started this, they haven't finished it. You give it to them, and it's the ones that will come back to you within a week or 2 weeks saying, I've made a start, this is the draft. You know that they're the ones that are actually going to follow through. 90%, unfortunately, you never hear back, you never see that. And I think that's a shame, because you've been given an opportunity, and that's one bit of advice. I think if you go to someone, or you're showing that you're keen to maybe do some research or an audit, anything, you've got to follow through.
Yeah.
Because that's once you've been given that opportunity, if you're the person out of 10 that comes back with an output, you've got a presentation. Next time they've got an idea, you're the first person they're going to go to give that that next project to. And that's what I did. And going from having absolutely zilch on my CV, sort of academically or extracurricular, I built up a few things just within sort of my first SHO job in plastic surgery, and it just sort of snowballed from there, because I just, if I was given something to do, I just made sure it was done. And I think that's something that people should try and do. It doesn't look good if you're given you show you ask for something, it's sort of given not on a plate, so you have to work hard for it. But if you don't then produce the goods, it doesn't set a great sort of tone, and you're less likely to be given more opportunities. So you've just got to follow through and produce the goods, because it's the same in any specialty. Everything is competitive, and you've got to make yourself as competitive as the next person or more. And I think that's not just plastic surgery, that's every specialty. It's not just surgery. Every specialty, you want to make yourself as competitive as possible.
I think that's a great piece of advice that hopefully the listeners take away. If you're given like an opportunity, especially the conferences and projects that don't come around too often, then definitely grab it and make the most of it. What is the training pathway like?
So plastic surgery is a 6-year training pathway once you reach registrar level. So usually after core surgical training, most people that get into plastic surgery have done a plastics themed core surgical training, so they may have had a year within their 2 years, but not all. I think I'd done 10 months of plastic surgery when I got my first registrar job, so it's not essential. But once that's the sticking point, is getting your national training number. It used to be sort of plastic surgery, cardiothoracics used to be the ones that were deemed the most sort of competitive. I think now having the last few years seeing the competition ratios, it's surprisingly less. Well, it's not as anywhere near as competitive as it used to be. So I think previously a lot of people may not have looked at some of the other specialties, neurosurgery, cardiothoracics, plastics, that had a sort of higher ratio. So 20 to 1, 20 applicants per registrar job, I think it was around the time. Now it's sort of 3 to 1. So that's another piece of advice. If you want to do a specialty, go for it, do it. Don't let anyone say, oh, that's you sure that's quite competitive, you're going to have to do X, Y, and Z to get into that. If you find this career that you see yourself doing in the future, don't let anyone say you're not good enough to do it, you're not going to make it because you're not ambitious enough, or you haven't got the drive. Because you can get into any job you want to. You have to put in the work, but the jobs are there, and it's not as competitive as it used to be. I don't think any specialty is compared to how it was maybe 10 years ago. So once you get your registrar job, it's a 6-year training pathway, and depending where you are in the UK, so in Wales, one of the draws for Wales is we have one plastic surgery unit, so you don't have to travel. Some deaneries, you may be working 6 months in one unit, then the next 6 months you may be 50 miles away or 100 miles away. So you maybe some programs. In Wales, we just have the one, so you work 6 years through one unit, which is great for that reason. If you have family, children, that sort of thing, you're not living away from your family. However, as obviously the downsides are, you only see how that unit works. So there's pros and cons to each, but it's a 6-year training program. You work through all of the different subspecialties within that. There are some academic pathways where some trainees, academic trainees, will do an 8-year training program, and they'll have a built-in research degree as part of that. That's the same again in other specialties. And then you have to get your FRCS, your fellowship examination at the end, usually after your ST7 year. Fellowships are common. My unit particularly, we're very, very encouraging of fellowships. We like people to go away to different parts of, whether it's the UK or across the globe, to learn new things and bring it back. If they want to come back and work in the department, we really encourage people to go and learn new things that they can then bring back and teach us and teach our trainees. So sort of specialty fellowships are very much encouraged and quite common in plastic surgery. Of my group of friends from medical school, there's only a handful of us that did fellowships. A lot of other specialties, it's not as common, or it's not as sort of sought after. It's uncommon to get a job in plastic surgery, consultant job, without a fellowship, because it is so subspecialized. So fellowships are quite important, and they're sort of thing that you should look at quite early in your, the early you know what you want to do, you can sort of sort out these fellowships. And they're great. There's fantastic fellowships in the UK. I was fortunate enough to do a fellowship abroad and one in the UK as well. So I sort of had both experiences. So yes, that's the sort of general pathway in plastic surgery.
And as with any specialty, it's quite a lengthy training pathway, but it does seem quite exciting. But that leads into my next question, which is, do you think there are certain personal and professional sacrifices that we have to consider when thinking about different specialties?
There are everyone. I don't think plastics is any different to any other specialty. You work hard in any specialty. The hours can be long in any specialty. Yes, it's a 6-year training program, so it's maybe slightly longer than some of the others. I don't think there's any differences between specialties, but long hours, you can expect that in any specialty. As I said, sometimes depending what training program you're on, in which deanery, you may be away from your family for a period of time. I was very fortunate, and as I said, in my unit that wasn't the case, but I've got friends, plastic surgeons, who've worked in other units where they've been away from family, 5 days a week for a year or more throughout their sort of training. So that's something you need to consider. Or something, if you've got a family that you can move with you, then that's less of an issue. But traveling, being away from family is a potential sacrifice in any specialty. I think female trainees, we've got about 25, nearly a quarter of our plastic surgery trainees are female. So that number is increasing. I think it's gone up about 10% in the last decade. And we've had quite a few. When I was a registrar, we had a few of my registrar colleagues were less than full-time trainees, and again, that was, they were supported fully. So being a female trainee in plastic surgery, there's no reason why you can't be less than full-time trainee, have a family. A lot of my female colleagues went through that, and it's supported. Where I work, definitely, it's very much supported. So again, that shouldn't put you off a certain specialty, the fear of whether you'll be able to have a family. I think that's the same across any specialty, and I don't think your choice of career should play a role in that.
And that's a lesson that a lot of the guests I've had before have spoken about, which is, if you're a female or if you want to have a family, what specialty you do shouldn't deter you in any way. And I think that's still a big worry amongst people, so it's good to be reassured about that.
Yeah, a few of my colleagues are, very keen on the women in surgery sort of aspect and have spoken it. So there's another thing I forgot to mention, that if you're a medical student and you're thinking about a career in plastic surgery, there are certain things that sort of look at your universities. So Cardiff and Swansea both have plastic surgery societies now, which seems crazy to me because, as I said, when I was a student, it didn't exist. But they've got their own plastic surgery surgical societies within the university that will have skills days where the local department will get involved and do some sort of surgical skills or some lectures around the subjects. I spoke at one in Cardiff University a few months ago, and within that, one of my female colleagues gave a great talk on sort of women in surgery, women in plastic surgery. And yeah, I completely agree with your previous guest that shouldn't deter you from wanting to have a family. Shouldn't stop you doing any specialty in this day and age. I think that's long gone.
And as you said, there is a plastic surgery society at Cardiff, and I do see them hosting some events. So it does mean that there's some progression, which is really good because it's exposing us earlier. than maybe what you would have exposed to when you were in training.
Yeah, there's also a so BAPRAS, so the British Association of Plastic and Reconstructive Aesthetic Surgeons. That's our sort of specialty body, the national body. They have, I think it's annual. They have a undergraduate plastic surgery day as part of BAPRAS, which is open to all sort of UK medical students. It's very heavily sponsored, so I think it's very quite cheap to reasonable to attend. And there are courses that again have some great speakers from different parts of the UK talking about specialty, sort of giving an insight into it, and then some sort of hands-on surgical skills, sort of teaching within plastic surgery, so suturing, little basic skin grafts and flaps, that sort of thing. So anyone interested in plastic surgery should look at the BAPRAS website, because there's some great stuff for undergraduates there, just to get a bit more insight into the specialty. They're good days.
I'll definitely try to link that in the description to the podcast. And now we're moving on to the more advice portion before we wrap up. And the first question I'll ask is, can you think of if there were medical students or junior doctors listening to this podcast and they feel quite overwhelmed because they're not sure what specialty they want to pursue, they're not sure what activities they should take part in, what would you say to them if they're feeling quite overwhelmed?
Subscribe to your podcast. Get an idea about the different specialties.
Love that.
No, it's a difficult one. It's, there are resources out there, but unless you know about them, as I said, I've just mentioned one, for example, but, unless you actually know you want to do plastic surgery, you're not going to go looking for those sort of things. So it's trying to make the most of every opportunity you get presented to you in your, medical school, trying to see as many specialties as possible, medical, surgical, pediatric, etc. And trying to find something you love, because at the end of the day, you're going to be doing that job. Your training is going to be long. I think it was about 19 years from starting medical school to getting my consultant job. I did a few other things on the side throughout that process, but 15, 20 years to get to that moment. But then you may have 30 years as a consultant. So it's a really big decision to make as to what career to go into, because there's not many people that reach the end of their sort of training and then decide to do something else. It does happen. I know people that have done it, but it's not common. So you need to, making that decision is a big decision. So trying to expose yourself to as many different avenues as possible before you make that decision. Speaking to people, having a mentor is great. Again, that's often once you actually find a career you want to do. I was fortunate I had some great mentors when I was a junior doctor in plastic surgery that sort of saw me through the whole process. So trying to get a mentor early that will help sort of guide you and help with some of your decision makings. And as I said, electives are a great way of, if there's something you think you may be interested in but you're not sure, doing electives. Taster weeks as junior doctors, they're great. Again, they were definitely were encouraged when I was a sort of a junior doctor. So make the most of your study leave, which is built in, I think, to taking taster weeks and try and experience things. Go to conferences, go to different surgical societies, go to medical societies within the university. You've just got to try and see everything possible to make that, see what catches your eye, really.
Just try to find what's out there, because there's so much.
There is, and you may not know about it. As I said, I didn't know about plastic surgery until I was exposed to it.
Yeah, which is kind of scary when you think about it, because as you said, we're only exposed to a limited amount of specialties in medical school. And what if, we get to specialist training and realize, oh, something else exists that we probably would have liked a bit better.
But then again, you shouldn't stay in a job that you don't love. I would say if some people will get themselves into a rut, into a job that they don't enjoy, they don't see themselves working the next 30 years in, and thankfully I haven't had to do that, but making that decision to say, actually, this this is not making me happy, this is what I want to do. And, you know, even you're taking a step back, you know, you shouldn't be forced into doing something you don't want to do. And even if it looks bad, you know, you've got to make that decision that's right for you and for your, you know, your mental health, really. You've got to make the right decision. But if you make the wrong decision, there's no shame in saying, actually, this isn't right for me, this isn't what I'm meant to be doing, and changing route, taking a step back, going into something different, taking some time out. You know, people do that more now. I think it was probably less common maybe 10, 20 years ago, but people change jobs now. And people, you know, a consultant job, for example, I don't think many consultants changed jobs maybe 10, 20 years ago. But now consultants move, and times change. And you've got to make decisions right for you, for your career, for your family. So there's no shame in altering your route, because I said you're going to be doing it for 30 years.
That's a good chunk of advice right there. And you've been doing this for, as you said, 19 plus years. So when you think back, is there anything that you would have changed along your journey to where you are now?
It sounds very cliche, doesn't it? I wouldn't change a thing. Would I change anything? God. There's one moment which I can remember very clearly that kind of may have altered my sort of career path. It was the same sort of prolific surgeon that gave me the talk about how he used to do bowel resection followed by hip. He was an old school general surgeon, and I think after my foundation year, me and my now wife and some friends were moving to Australia to do a year working in A&E, having a nice fun year. And he said to me, "Oh, I thought you wanted to be a surgeon." I said, I do, Mr. Sensei. And he's like, "Well, don't go waste your time bumming around for a year in Australia. Go and do anatomy demonstrating for a year. That'll make you a true surgeon." And I sort of, don't know if I'm allowed to swear, I my pants and was like, "Oh God, I should, if I go to Australia, I'm never going to be a plastic surgeon." And so actually cancelled the job that I had landed up in Melbourne and went and did anatomy demonstrating, which is a sort of a pivotal time, because that hugely helped me in my sort of career path, because I had a year of proper teaching, which scored very highly in applications. It was great for anatomy. I did my exams during that year. But I think the advice was probably wrong. Not in that, doing anatomy demonstrating was great, but I think having that a year in Australia, as a junior doctor, I don't think it would harm your career progression these days. I don't think you should be advised against it. It's a life experience. I said we did get back to Melbourne on my fellowship, however many years, 12 years later, and had the best year of our lives. And I think we could have had that 10 years before. Whether my life would have been different, whether we would have stayed there, who knows? But I think, again, don't let someone say, by making a certain decision, that's going to completely ruin your chances at a career. But it's difficult, because I kind of regret that, because I know we've had an unbelievable year, but also in a way the advice did probably help me. So
Yeah.
Probably hasn't answered your question. I'm just mumbling now, but it's a moment I can literally remember the conversations if it was yesterday, because it really scared me. It's like, oh my God, I can't through this. I want to be a plastic surgeon. And he's just told me I'm going to fail if I go and bum around in A&E for a year in Melbourne. But I think that's wrong. I don't think that, a life experience is a good experience. And you never know what will come from any of those experiences. That sounds like answered. I'm sorry, I didn't really answer your question.
No, you did.
But no, I'll give you the cliche. No regrets.
No regrets. Not. No. And that reminded me of something that one of my favorite podcasters says, and he's like, the perfect decision can only be made in hindsight. So I guess, like, in that moment, you were just like, what do I do? Which decision? But as you said, it helped you either way.
Yeah.
So
Everything happened for a reason, and that's the path that I took, and that's got me to where I wanted to get to. And we still had a great year in Australia. Just a bit later, unfortunately, we had kids with us, so wasn't quite as fun.
And you've sprinkled like golden nuggets for listeners to take away throughout the episode. But is there any last minute piece of advice that you would give to any medical students listening?
Yeah, I think I've already said it. Is find something that you love, and then you've just got to find out early what are those hoops. It's all about, unfortunately, there are great doctors out there in my specialty, for example, that may never get that training job because you've got to play the game and find out the application process early and put it up on your wall, and you've got to tick those boxes, unfortunately. But don't let anyone say to you that, oh, are you sure you're up for that specialty? That's quite a challenging one. It's a long process, or long hours. You need to do a high research degree, etc., etc. If you want to do something, you'll be able to do it, and go for it.
And for our closing question, I ask everyone this because I'm really interested in the answer. But when you think about it, what's the best piece of advice you've been given that has shaped you as a clinician?
Ooh, I can tell you a technical thing that as a plastic surgeon, the one tip that I always remember, and I try and tell people, so as I've already said, plastic surgeons, we don't get stressed out by big wounds, making big holes, and often other surgeons are like, oh, we don't want to make the hole that big because we might be able to close it. That's not a thing in plastic surgery. So a very nice piece of advice as a plastic surgeon, and I would say this for any specialty, the path, the misery, or the path to complications are paved through small incisions. So don't, and I had this very same thing last week, watching one of my orthopedic colleagues trying to do an operation through a hole this big. And I stood over his shoulder and I bit my lip for about 10 minutes and then said, mate, just make the hole bigger. And he's like, no, I'm not going to do it. And then after another 10 minutes of struggling, he made it twice the size and did what he needed to do in about 30 seconds. I said, Mr. So-and-so, the path of misery is paved through small incisions. So that's a technical bit of advice I've always remembered. But personal bit of advice as a clinician, or what I just said is who said, if you're serious about this, don't put your mind to it. You'll get it. Don't let anyone say, are you sure you weren't a top A grade student in university? You haven't got 5 publications as an F1. You're not going to be good enough. There's time over your career to build up these things that you need to do. So just go for it.
Perfect. Well, thank you so much. That was a great conversation. And listeners, we hope you enjoyed it. Yeah, no problem. We hope you enjoyed it, and we will see you again next week.